today I have with me a very special guest, Dr. William Oyebeke. Dr. William, you're welcome to the show.
Thank you very much.
Now, please, can you just give us a brief introduction about yourself, what you do, your practice, and...
Well, I do obstetrics and gynecology. I would say that most of my work most of my time is utilized in actually seeing patients. And secondary to that, I do a lot of teaching. I teach the residents here at Southside Hospital. I teach residents from Lincoln Hospital on how to operate, do many operations in the OBGYN. I also teach medical students. So in addition to practicing medicine, I do a lot of teaching.
Okay. Do you have any specialty dealing with the elderly?
Yes, I do. Yes, I do. I have over 20% of my patient populations are elderly.
Okay.
In the elderly in terms of postmenopausal patients, and there are certain issues that are quite special, among the elderlies.
So what specifically is your area of specialization?
Well, I do practice general OBGYN.
Okay.
I do a lot of surgeries in terms of hysterectomies. I do that. I do a lot of deliveries of babies. I do a lot of workup for patients who come in with urinary stress incontinence, postmenopausal bleeding, things that are really significant among the elderlies, and things of that sort.
Okay. So in addition to your practice, do you also have any other business engagement? I mean, I'm looking at your resume here. You have a private practice where you
Yes, I do. I do have private practice here. In addition to my teaching OBGYN in the hospitals, I do engage in full practice here in Bayshore.
Okay. And a significant, you said 20% of the population that you see
are elderly.
Okay.
Yes, postmenopausal patients.
Okay, so today we're going to be talking about a very important topic, very special to the heart of the older people that are watching us today.
Mm-hmm.
And the first topic that would like you to speak about is vaginal bleeding in the elderly. Can you shed more light on that?
Oh,
what is vaginal bleeding?
Yeah, that's a very important topic. Bleeding among the elderly, especially patients who are postmenopausal, once a patient comes in and tells you that they're bleeding, it should be taken very, very seriously, because it's cancer until proven otherwise.
Okay.
So patients who are postmenopausal have no business bleeding.
Okay.
It doesn't necessarily mean that all of them, have cancer.
Okay.
So it's very important to say that. But if a patient comes to you and say, well, I haven't had my period for over a year, and then they come in bleeding, you have to make sure that they don't have cancer. You have to assume that they have cancer until you could prove otherwise.
So what age should that be? I mean,
the average age of menopause in North America is about 52 years of age.
Okay.
But it doesn't necessarily mean that everyone who's postmenopausal is actually 52. There are patients who undergo menopause at an earlier age. So once you don't have a period, for about a year, and you could prove chemically your FSH, is elevated on 2 separate occasions,
okay.
Beyond what they should be in a postmenopausal range, and you make that diagnosis, then when they come back complaining of the fact that they're bleeding, you should take that very, very seriously, and then you could do workup. So the question is, what are some of the workup that you could do to make sure that the individual either has or doesn't have cancer? You could start with physical examination.
So that is after they experience bleeding.
Right. After they experience bleeding, and you have to then see the individual. They have to come to you,
okay.
You as an obstetrician gynecologist, examine the patient thoroughly.
When do they have to come?
As soon as possible.
Oh, okay.
As soon as possible. You can't be bleeding and then staying home and say, I'm going to go see my gynecologist in a year or in a couple of months.
So it should be immediate.
It should be immediately.
Okay.
Call your If you can't see your gynecologist, at least you'll start with your primary physician. But
okay.
The appropriate person to see is the gynecologist. Once you go in, the gynecologist will obviously take a detailed history. If you come in and tell me, well, I'm staining after a night of sexual activities, but that could also tell me that, maybe it's trauma from sexual activities, and that could lead to other things. But anyone who is bleeding after they've attained the age of menopause, that has cancer until proven otherwise. So they come in and you do a thorough history, you do a thorough physical examination. The physical examination by itself can shed light as to where the bleeding is coming from.
What are the type of examination that they have to do?
They have to undergo pelvic examination.
Oh, okay.
Then you bring them in and you do a thorough examination. looking at the vaginal wall, looking at the cervix, examining the uterus to see what the size is. Because sometimes if you do have, cancer of the uterus, the uterus could be enlarged.
Okay.
It doesn't necessarily mean that all cancers give you enlarged uterus. But once you have bleeding, you have to make sure that you ascertain first where it's coming from and what the likelihood of cancer is.
Is there a genetic aspect of bleeding that if it's maybe inherited or something, is that?
Well, yes, I would say yes, because some people, if not necessarily in postmenopausal patients, in patients who have fibroids, for example, there is some genetic predisposition to that. There's also genetic predisposition to ovarian cancers and things of that sort. But cervical cancer, not quite. I mean, you have human papillomavirus as cause of most cervical carcinomas. But people who have those are not necessarily postmenopausal.
Okay.
It doesn't mean that a postmenopausal patient can't have cancer of the cervix. They definitely can, especially patients who have not been having pap smears on a regular basis. So once an individual comes in and says, well, I have vaginal bleeding, it's very, very important to get a thorough physical exam, together with with thorough history, because the combination of the two can lead you as to where you think the bleeding is coming from, and then what the treatment should be.
In your practice, when you talk of treatment, for vaginal bleeding, is there a treatment? Is there?
Yes,
what can be done to
there's
prevent
definitely. It depends on what the cause of the bleeding is.
Okay.
If it's cancer of the uterus, then you have to go ahead and do surgery.
Okay.
Depending on whether the individual is healthy enough to undergo that.
Okay.
If it's coming from the cervix, then that's a little more tricky, because then you have to work the individual up with radiologic testings like CAT scan, etc. Then depending on what the stage is, if it's an advanced cervical cancer, then you can't really do surgery as such. You may well give radiation therapy.
Okay.
If it's uterine cancer, then you may lean on the side of doing, hysterectomy by removing the ovaries as well and sampling the nodes.
Okay.
If it's vaginal cancer, then it may be a combination of surgery, radiation, chemotherapy, that sort of thing. If it's from trauma, from sexual activities, there are a lot of things that we can do. You can examine the individual and see, okay, the individual is having bleeding from sexual activities. Is it trauma? Is it from trauma? Is it from dryness of the vagina? If it's dry, which is rather common among postmenopausal patients who are sexually active, then you could say, what can I use to soften the vaginal wall to make it that sex is not as painful or there's no bleeding after sexual activities? We could have estrogen replacement therapy, but most people will give estrogen cream.
Okay.
Estrogen cream works wonders in terms of building up the mucosa of the vagina and moistening the vagina as well, so that the individual doesn't have pain with sexual activity. But prior to giving estrogen, now we have actually medication in pill form that you could give an individual to soften the vaginal mucosa.
Is that over-the-counter medication,
No,
or it has to be prescribed?
It has to be prescribed by the physician.
Oh, okay, so regardless, you still have to see your doctor.
Where you have bleeding, there's no such thing as home remedy
Okay.
for postmenopausal patient. It's cancer until proven otherwise. Not only do you have to go to your physician, you have to go to your gynecologist to do special tests, to do physical exam to make sure that the bleeding itself is not cancer. And if it's cancer, then we'll deal with it. The sooner the better.
Bleeding of any kind after menopause is not normal.
It's not normal. It's abnormal.
It's abnormal.
It should be viewed as cancer until proven otherwise.
Okay. So in other words, you have to seek medical attention right away.
Immediately.
Okay.
Immediately.
I hope that our viewers, if you have any question, you can always write us. And I hope this information has been very helpful to you. Thank you so much.